Welcome to our comprehensive guide on using the Kojak Auto Disable Syringe. Let's first understand the difference between the regular disposable syringe and the Kojak Auto Disable Syringe. When you use disposable syringes, there is a chance of reuse. To mitigate the problem, we have a solution. The Kojak Auto Disable Syringe, which does not allow healthcare professionals to reuse the syringe. After the first injection, the plunger gets locked, rendering the syringe unusable. Discard the used syringe components in the sharps container. Before giving the vaccine, make sure you have a new Kojak syringe, vaccine vial, alcohol swab and a sharp container. Take the syringe out of the blister pack. Remove the protective cap from the needle. Be careful not to touch the needle while pulling the protective cap. Insert the needle into the medication vial. Before filling the vaccine, ensure the needle tip should be submerged in the liquid or you will fill in the air. Pull back the plunger slowly to draw the necessary dose into the syringe. The plunger is set to draw 0.5 ml of vaccine plus 10% from the vial, preventing vaccine wastage. Check for air bubbles while drawing a vaccine. Inside the vial, tap the syringe to remove any air bubbles and adjust the dose accordingly. Locate the injection site on the patient's body. Cleanse it with an alcohol swab and insert the needle at a 90-degree angle. Administer vaccine by slowly pushing down the plunger. After administering the full dose, withdraw the needle and cover the injection site with a swab. After the full administration of dose, the plunger locks automatically to prevent reuse. If reuse is attempted, plunger will break. Discard the used syringe components in the sharps container. Know more about Kojak Auto Disable Syringe at hmdhealthcare.com.